you feeling tightness? No tightness?
Kind of.
Because I can hear the wheezing, actually. So you probably would benefit from having your nebulizer right now.
Camden school nurse Sheila Colalillo is quickly able to treat David's asthma in her office, but that wasn't the case 3 weeks earlier because this fourth grader didn't have an asthma treatment plan on file at a school.
And I, looking at him, immediately knew he was having a really bad asthma attack. He was taking short, rapid breaths. His neck muscles were all engaged. He was using all of his neck muscles to help breathe.
It was a scary situation. David had to be rushed to an emergency room and spent 4 days in the hospital. Improperly managed asthma is one of the leading reasons children miss school. Once an asthma diagnosis is made, state law requires the child to return to school with an asthma treatment plan. Yet some parents say it's tough to get one from either their doctors or the ER.
Here in Camden, I know that 1 in 3 students have been diagnosed with asthma. I know that in Sumner School, which is where I'm the certified school nurse, we have approximately 90 asthmatics to date, and only 30 of my students have an asthma treatment plan.
For over 20 years, the Johnson & Johnson School Health Leadership Project has offered resources and training to school nurses nationwide. Now, thanks to additional funding, more New Jersey school nurses are getting training too. That helps with a variety of health issues affecting children, such as asthma control. The funding comes from New Jersey Health Initiatives, the statewide grant-making program of the Robert Wood Johnson Foundation.
We realized we weren't reaching all the nurses in New Jersey, and so this partnership enabled us to reach deeper into the variety of districts in New Jersey.
An 18-month fellowship for school nurses includes intensive training in leadership and management skills.
I want to hear from you. Because as we said, we're really about conversations and partnerships, and this is where we start to form those partnerships and relationships that are going to allow us to build healthier communities.
School nurses get the tools they need to work across disciplines to address health at the broadest level and to help parents ensure their children can live the healthiest life possible.
I think that the Johnson & Johnson Project and NJHI has helped me to venture out where maybe I wouldn't go, where I wouldn't take the problem on and work on it with the intensity that I'm working on it.
Another component of Camden City's asthma management program recruits students with asthma for a school flag program.
Today it's a green day, so it's a good day to be outside. The air quality is good. If the air quality wasn't good, children with asthma can recognize by the color of the flag what measures to take to prevent an asthma exacerbation. For instance, if it was a moderate day or an unhealthy day, they may play inside.
To help promote good air quality, school buses aren't allowed to idle while waiting for kids.
When you have an idling bus, you have exhaust, and the exhaust contributes to the air pollution, and air pollution is a common trigger for an asthma exacerbation.
There are high rates of asthma among Latino children, so it's important that community partners like the Hispanic Family Center of Southern New Jersey do outreach.
And they'll go into the homes and they'll even provide vacuums so that parents can vacuum up any dust mites or anything that's going to is an allergen for the students, which is really, and cleaning products, they'll do those kind of things.
We want the residents of Camden to know that there's services out there so that children can know what the triggers are about asthma, so that they're not using the emergency room as their primary care physician, and that they're not missing school days.
I think the data will also support what we're saying about the absenteeism rate.
Danielle Cooper of the J&J School Health Leadership Program works to make sure outreach efforts stay on track.
The goal here is to ensure that the community here in Camden gets all the information and resources they need to feel empowered to know that asthma is a condition that they can deal with. It's a condition that they can get education around and information for their family to help.
The New Jersey Health Initiatives and J&J are also supporting a community cafe project in Camden.
Did they enjoy being able to talk about it? Did they feel?
Yes, because especially, like I said, it's the opportunity for them to talk. Because when they go to the clinics, different clinics in the community, not always they have that time for somebody to listen to.
Bilingual family health workers are critical to the success of the Cafe project.
A lot of our parents are Spanish-speaking parents, so they don't understand the English too much. So I had to translate for them and give them also my feedback on what I believe about the health system that we have here in Camden.
The Cafe project examines the barriers to health care in Camden. Continuity of care is a big issue because many parents run into problems setting up doctor's appointments either by phone or in person and use the ER instead of taking a sick child to his own pediatrician.
They found that they couldn't get through on the phone. I mean, a lot of these parents work and they don't have time to be on the phone a half an hour, 30 minutes to get an appointment. And that shouldn't be.
They also said that there's a lot of time wasted trying to get paperwork for school and for school nurses. And so as a result of listening to their frustration, we'd like to do a time study and see how much time is wasted on both ends. How many days kids miss from school because they're excluded because we don't have what we need. It shouldn't be that way.
Both Camden school nurse projects aim to solve systemic problems.
I think, with two powerful partners, Johnson & Johnson and the Robert Wood Johnson Foundation, I'd like to see New Jersey become the model state for how nurses are empowered to improve the health of communities and the children in those communities.